I knew from a young age that I just wanted to help people. I had that really broad sense of wanting to do better in this world. And I had an aunt who was a nurse, and she developed brain cancer, and she went through that about 10 years before she passed. But seeing what she did and knowing how it made her happy, that sparked my interest. And then I carried it on further because I knew she had wanted to continue her education. She was an LPN, and I am the first college graduate in my family. I moved to Abbeville County when I was 10 years old, so I've been here for most of my life. And I'm now the ICU clinical manager here at Abbeville. And this year I finished my bachelor's degree from an online university. I was the teen mom. I got pregnant at 15, and at that time there was no other option. You got married, and so that's what we did. We got married, and I graduated about 5 months later. My little girl, who is now 17, was 2 weeks old at my high school graduation. I tried to go into nursing straight out of high school, but since I graduated at 16, I wasn't old enough to take my clinicals. So I went back to what I knew and what I enjoyed, and that was automotive, until I was old enough to switch to the nursing program. And I decided that I love cars and I love working on them, but only as a hobby. I could not do it for a living. When you're a mom and when you're a wife and when you work full time and you have other interests to pursue in education, you end up, you know where to place your priorities. The one thing I love about my job is that it allows me, the way my schedule is, I get 6 days off in a row every other week. I know that I have 6 days off, so I can plan accordingly for what I need to do. And that helps me too to bring everything into focus and how I'm going to balance it. You can look at what the human body needs and what your car needs, and they are so similar. Because you have, a nutritional standpoint, what kind of fuel are you putting in your body, what kind of fuel are you putting in your car? Are you taking care of changing the oil and keeping the joints and everything working well and replacing what needs to be replaced when you have to? It rolls so well together, and it's all that diagnostics and being able to look at this vague problem and you track it down, and then you can fix that problem, and that feeling of accomplishment of knowing you made it better. I don't care if it's mechanical or human. You helped fix that problem and you made it better and ultimately improved the outcome. Healthcare's not going away. It's going to be there forever and ever, amen. There are going to be sick people who need care, so the jobs are going to be available, and then you have the ability to travel all over the world and somebody else pays you to do it. We have travel health care all over the place, so there are so many opportunities. If you're looking for job security, stability, and variety, healthcare is definitely where it is at. Nursing is such a broad field, and it attracts people from all walks of life, and no matter where you come from, that isn't what matters. What matters is where you're going and what you're doing to get there. It can be done by anybody, and no one can stop you from gaining that knowledge and getting that degree and making a change in this world. You're the only one who can control that. So.